Repeatedly, the Premier told us that modelling didn't exist and that he didn't think it was useful anyway. Subsequently, the Minister of Health said, well, maybe AHS had some modelling and maybe they were looking at it, but that it still wasn't necessary to release it to Albertans. So today, we released it, or some of it. Now, as the pandemic rages in this province, we are consistently seeing pressure on hospital bed capacity that nears or exceeds the worst-case scenario based on this modelling. And again, the same modelling that the Premiers claimed didn't exist. Not only do we now know that it does, in fact, exist, but at the most critical moments of this pandemic, when cases were skyrocketing and the Premier should have seen what was coming, he was MIA. The Premier saw this coming and did nothing. Now, we're already at 91% of ICU capacity, and those same projections show a worst-case scenario of 161 people in ICU by December 14th, just 2 weeks from now. And yet the Premier has indicated that he will not even review his grab bag, lack of evidence, inconsistent measures until December 14th. Healthcare workers are already exhausted and overwhelmed. Hospitals are already nearing the brink. We're already running out of oxygen. To be clear, I suspect very much that just because all we could release was 2 weeks forecasting or modeling out, I do believe that they probably have information for more than 2 weeks. And in either way, I think if the government decides that the lesson today is to debate the difference between the word forecast and model, then I think they've lost the plot. I think the lesson today is that even with the Premier's half measures, their own projections are that we are going to get to a place that is dangerous and that we need to act now. We can't afford to wait.